Well, here we are with Dr. Napolitano again from New York, Mineola, New York. How are you?
Very good. And yourself?
Good. So have you been snowed in the last week or so? I mean, an early October snow?
Just a little bit of snow.
It's quite amazing.
Unexpected.
Yeah, quite amazing. Well, Dr. Napolitano, you're an optometrist. Basically, you're taking care of people's eyes. So let's talk about some of the major eye illnesses which are out there, which, or situations which we have to, really look for, worry for, and do things to prevent it or to cure it. Such as cataracts, glaucoma, macular degeneration. Let's start with glaucoma. Tell us all about it. Tell us what are we experiencing? How can we, the patients, have some inkling that something is wrong and it may be this? Because some of the symptoms, they look awful similar, and perhaps we cannot ever even say what it is. Perhaps we have to go to a doctor. Anyway, tell us about glaucoma. What can we expect there if we have it? What can we do to prevent it or cure it if we have it?
Well, unfortunately, I should say the biggest problem with glaucoma is that it doesn't cause any symptoms until it becomes too advanced. So we very, very rarely see a patient come in that gives us a symptom of glaucoma. It's usually picked up during just a routine eye exam. The problem with glaucoma is that it's a very slow progressing disease that affects the nerve in the back of the eye. Okay, so if basically we were look at the nerve in the back of the eye right now, it looks like a donut. It's round and it has an empty space in the middle. We want that empty space to be as small as possible. Just like if you went to buy a donut, you don't want a lot of empty donut there. You want more of the rim, and that's what we look for when we examine the nerve. In patients with glaucoma, usually that empty space starts very small, and as the disease progresses, it becomes larger and larger. What that does is it causes loss of peripheral vision. Okay, so not just you and myself, it's very hard for a person to know that something all the way out in the periphery of their eye is missing, because also usually the brain fills it in. Okay, then once it becomes too advanced, where it gives what's known as the tunnel vision, that's where the patient starts noticing a problem. But by the time the patient notices that, hey, I can't see that good on my side, I don't have side vision, that's usually too late, because the damage that it's done, it usually cannot be recuperated. The best thing is to have yearly eye exams. So if there is any changes there, it can be picked up right away and treatment can be started early on. Now, the one thing with glaucoma that we try to control is the eye pressure, because that's the only thing that we can control. We cannot control the race, we cannot control the age or the gender, but eye pressure is the only one that we can control, and it's usually controlled with eye drops. If eye drops fail, then we will resort to some sort of surgeries to control the pressure. Okay. Your doctor will do several tests. One, he might take pictures of the nerve inside the eye. As I said, check the pressure. We will check the thickness of the eye, of the front of the eye. We will also do what's called a visual field to check the peripheral vision, make sure it's intact. And usually, if we have a patient who we suspect has glaucoma, we would see them more often than just once a year to just make sure that things are under control. And if you are diagnosed with glaucoma, we would see it. Can I stop you for a second?
Sure.
Mr. Fly? Okay. Can we take a little break?
Yes. Okay.
Yeah.
Sure. Hang on here.